I wanted to give you guys a lip lift update for 2023. As you know, this is a surgery that I do a lot of, and so let's cover 7 different points about just, my views on the surgery and how it's evolved over the years. Point number 1 is that I think it's easy to underestimate the lip lift surgery. It always seems like it's not a big deal, you just remove some skin under the nose, and I think many surgeons have that mentality, and many patients actually come in with that same thinking. And I think that's faulty thinking, because even though it seems like we're just removing, let's say, 5 millimeters of skin under the nose, it is a very delicate area. It's easy to distort natural anatomy, which then makes it very obvious to tell that something was done. So I think proper technique under the nose and in the center of the face is very important. I also think proper planning is also crucial, and just having a good overall strategy for what will take place for the surgery. But really, no surgery should ever be underestimated. Every surgery deserves the proper care, time, attention that it requires to get consistent results, so that everyone who's interested can get some benefit from this surgery and doesn't walk away disappointed with their outcomes. Point number 2 is that I think that there's a therapeutic window for the number of millimeters, let's say, that are removed. And it's important to try each time that you do this type of surgery to get into that proper window. If you remove too little, then people are disappointed. They feel like, that wasn't really worth it, nothing changed. And sometimes they then come back to get a revision where then more is removed. The other end of the spectrum is when you remove too much. And that is also a tricky place to be in. I mean, what happens sometimes is that patients will push for more removal, and they really want to see an impact. But I think it's the surgeon's job to temper that excitement and to really keep things as safe as it can be while still delivering impact, because patients come in at the end of the day because they want to see a change, right? And then you have to be able to justify the fact that you're creating this scar under the nose and that you're putting someone through this process. They're paying money for it. So I think you have to deliver an impact, but you don't want to go too far. And sometimes I find that for the patients that are pushing me to go more and more, it's really my role to scale them back and to keep things as safe as it can be. But it's always a dialogue. It should never be one-sided, but there is also just a way to keep it as safe as it can be. Now, what do you do if too little was removed? Well, you can wait at least 3 months and potentially do a revision procedure where you remove more. I always tell patients that requires an entire second surgery with another recovery period, because for some reason some people feel like, well, it's going to be easier to recover from a second surgery. In reality, it just becomes like an entire second recovery period. So it's no different really from the first time. And as far as scarring goes, usually it ends up healing about the same, sometimes even better, assuming the same technique is used, of course. Now, what happens if you remove too much skin from the philtral area? Well, that can be tricky. I always tell patients to be very patient with the recovery process, that it takes at least a year for everything to fully settle, for the scar to mature, and for there to be some degree of recoil of the area. Now, some patients don't like that because they got a nice lift and they don't want to see it drop anymore. But for patients who feel like maybe too much was removed, they're not in love with the amount of tooth show that they now have, or they feel like, just that it was overdone for whatever reason, I always tell those patients to be patient. Very important. And for other surgeons too, don't just jump in and start to do any, heroic skin grafts and, things that could potentially look worse over time. But patients and their surgeons ought to be just very patient with the recovery process, and typically things settle down and those patients still end up very happy. But there is definitely a cohort of people where maybe a little too much was removed for their anatomy, and they just need to be patient with that recovery process a full year. And then, let's say they're still unhappy, I would say you can go through certain stretching exercises to get that upper lip to drop a little bit more so that you're happier. And worst case scenario would be something like a skin graft, but it's a very, very tricky area to perform a skin graft on, because it's hard to find analogous skin where it has a good match as far as the thickness. And if you lay a skin graft under the nose, you're going to actually start to see the outline of that skin graft. It's not going to look great. So typically you would try to avoid something like that. Point number 3 is to respect the nasal base. The nasal base is where the incision is made and where the ultimate scar ends up being. And sometimes you have to get creative because some patients don't have, for example, a nasal sill at the base of their nose. So part of the incision has to figure out where would a natural nasal sill lie. And so that is an important factor when planning out the procedure and doing all the markings. I personally like to spend a lot of time on that part. I don't like to rush through that part because that to me is the most important part of the whole surgery. Because if you're not properly set up for the incision and you've devised your incision line in a way that isn't natural to the person's nasal base, then the ultimate outcome is just not going to be great. It needs to follow the natural curvatures of the nasal base. Point number 4 is why I don't hide the scar inside the nose. I get many patients asking me, well, I know where you make your incision, why not place part of that incision into the nose? And I tell them that there are some surgeons who do it that way, and that technique has been described, many, many years ago. It's nothing new. The reason I don't do it that way is because then you're taking the lip area and you're pulling it essentially into the nose. So you're crossing over certain basic facial subunits, which then ends up looking more artificial, and it makes the nostril opening look very big. We know that with lip lift surgery, you can always get a little bit more of an opening of the nostrils because the nasal sill can get a little pulled down with the sutures and just the surgery in general. But when you're making the incision into the nose, you're guaranteed to get a much larger nasal opening and for things to just look more artificial. So the overall strategy that many of us lip lift surgeons take on is to really try to separate out the nose from the lip. And the way to do that is to create your incision right where those two meet and to not go inside the nose with the lip lift incision. Point number 5 is hypertrophic scarring and the incidence of that. In my practice, the current incidence of hypertrophic scar, which is a heightened scar, is about 3%. So 3% of my patients will develop this thicker scar. And it doesn't mean that it necessarily is a wide scar, but it usually means that it can be a raised scar and not a keloid, because remember, a keloid is when the ultimate scar is growing outside of the boundaries of the original incision, whereas a hypertrophic scar is just a thickening of the incision line. So two very different things. Keloid incidence of the central face is almost 0 in the literature, whereas hypertrophic scar under the nose is not that uncommon, and even with great technique, about a 3% risk is what I'm finding. Now, what if you're one of the patients who develops this? Is it like the end of the world? Is it like that there's no way to treat it? And then the answer is no, there's definitely a way to treat it. Typically, I'll start some Kenalog injections, which is a type of steroid injection, into the thickened scar. And that can start as early as like 4 to 6 weeks out. And we repeat that type of injection every 6 weeks into the areas that are still raised. Now, it always is the case that eventually, if you keep up with the steroid injections, the scar will flatten. And once it flattens, some patients don't need any laser treatment or anything else, whereas other patients might benefit from some laser resurfacing and occasionally even cutting out the scar and resuturing. Now, if I were to do that on a patient who previously developed hypertrophic scar, my approach is to inject Kenalog, which is that steroid, at the same time as I'm closing the incision. So that kind of gets the process started of trying to keep that heightened response of healing at bay. Point number 6 is lip reduction to show teeth. Now, many patients are coming in for a lip lift because they want to show more of their upper teeth. And I always tell them that's not a guarantee, but that is often a byproduct of a lip lift surgery. But there are some patients where they have a lot of lip volume and the red lip is just fuller. And even if you were to evert that red lip out with a lip lift, some portion of that red lip will still hover over the upper teeth and cover them. So sometimes patients might need a cosmetic dentist to do something to their teeth, such as lengthen the teeth or do some adjustment to the teeth. Other times they might benefit from a lip reduction, especially in certain portions, to be able to expose those upper teeth. It's not always the lip lift that's able to do that. So that's important to keep in mind. And point number 7 is a question that I get often in my consultations from patients, which is it worth it? That is it worth it question becomes very difficult for me to answer. I feel that surgeons ought to provide information and educate patients on pros and cons of surgery, and to also tell a patient, like, are you a candidate for the surgery? But at the end of the day, the patient has to decide if it's something that's worth it for them. And that's the same for, I think, any cosmetic surgery, or probably, most other surgeries too, because even if you're getting, let's say, cardiac type of surgery that's a little bit more life and death, there still are risks of that surgery, and you have to weigh the potential pros against the cons. And same for lip lift surgery. Patients need to assess the situation with the cost of the procedure, the recovery time, the potential risks of complications, and also weigh that against, of course, the benefits that they might get, such as improving the way they look, the way they feel, certain elements such as that. So that is why I find myself not being able to answer that question, and I push it back onto the patient and say that is something for you to decide, but I am here to provide any information that I can to help you reach that decision. So that is basically an update on some of the, points that I wanted to cover about lip lift surgery. Some of these I've been thinking about over the course of the last year, and we'll see what the next year brings, and we'll cover more things next year. So if there's anything specific related to lip lift surgery that you feel like we haven't covered or that you want to hear more about, make sure to put that in the comments below. And if you haven't seen it, we've actually released a 4K full-length lip lift surgery for all of you to see, for the people who aren't too squeamish about the nitty-gritty surgical parts of the surgery. But many patients want to see, like, what is it like when he does lip lift surgery. So there's a full video that we're going to flash on the screen for you guys to check out. So yeah, we'll see you soon. Make sure to like the video, subscribe, and turn on notifications. Thanks.